Have you or someone you know ever thought about using antidepressants?
Well, it's important to have a good understanding of what antidepressants are, how they work, and what to do if they aren't working for you. And joining us now to go in depth with all of that is Susan Agel from CNS Healthcare. Hi, Susan.
Hello,
how are you?
Good morning. Doing well, thank you.
So, I mean, we've heard antidepressants, people take them all, but what exactly do they do? How do they work?
People take antidepressants obviously after they've been depressed, and with depression, it affects the chemical change in the brain. It can be something that's genetic, or sometimes people who have been stressed out for a really long time, or having circumstantial stressors, they can have the effect in their mood. And the antidepressants work on different chemicals in the brain to help restore that balance. And so there's different types of antidepressants. Some work on serotonin, some work on norepinephrine, there's some that work on dopamine, but all of those chemicals are involved in maintaining a balance.
So how does someone at home, if they're watching now and they are taking an antidepressant, how do they know that it's working well for them?
And that's often a very difficult thing for them to assess, because so many of the prescriptions are provided by primary care doctors these days. And so what you'll notice is the patients may see them a few times, but then they'll be sent out with some refills on their medication without some adequate follow-up. So the patients may just assume that's the best that they're going to get. But in reality, the patients need to look and determine, think back, well, when did I feel good? And do I feel that way now? And if you don't feel like you did back then maybe it's not doing the trick, and you need to look at something else.
And with technology and medical advancements, there's always new things that are coming out. Is there anything new in this realm?
The neuroscience industry, they're always looking at different medications, because this is such a chronic condition for many people. And some of the medications that we're looking at now are medications that work on those neurotransmitters, but work in different mechanisms where they may have faster onset of action. So instead of waiting 4 to 6 weeks to see an effect, maybe you can see something in 2 weeks. Also, to eliminate some of the side effects, because there's, oftentimes there's GI, gut side effects, stomach stuff. Sexual side effects are a main reason that people discontinue medications, and some of these newer ones are looking to minimize those things.
So you guys at CNS Healthcare are doing some clinical trials that are kind of focused in this area. What are you doing?
Specifically for people who are who think they're depressed but have never been treated before. You don't have to have any prior treatment. We can assess you and determine if a research study is appropriate. And then those that are already on the antidepressants, who may not think they're getting the benefit that they need. There are some that allow them to stay on their medication, but there's protocols that are built in, add-ons to add something to that to see if they can boost the impact as well.
Any distinctive signs that somebody might be looking for if they're wondering if they're feeling this? Anything that's kind of common that you see all the time?
Well, some people, when they're very, very depressed, they have the low mood, the sadness, the tearfulness, low energy, low motivation, that type of thing. And when they're on the antidepressants, they may experience some relief in that, but they just kind of still feel kind of just blah,
right?
Just like something's missing. And so if that were the case, I would certainly say come on down and let us assess your symptoms. Yeah.
Sure. And so it's important for people to know that they do not have to have insurance. They don't have to pay any money out of pocket, and they can get compensated as well.
Right. And for those enrolled, outside of seeing a board-certified psychiatrist, pretty much on a weekly or bi-weekly basis, you get physical exams, lab work, EKG, vital signs, looking at any underlying medical stuff. And so once you're enrolled, not only do you get that great service, but you do get a stipend for your time and travel for participating.
Okay.
And this isn't the only thing you guys have going right now. You always have different things that can help a lot of different areas.
Oh gosh,
what else
absolutely.
Do you have going on?
Folks with bipolar disorder, we have pediatric depression, adolescent attention deficit hyperactivity disorder, sexual side effects related to antidepressants. We've got a high blood pressure study going on. We also will recently be starting a diabetes study for patients who are taking metformin or glucophage. So a new diabetes study starting in about a week or two.
All right. Well, Susan, thank you so much as always for being here. We want to thank CNS Healthcare, of course, for sponsoring this segment.
Indeed. And to find out if any of their trials are right for you, you can call 904-281-5757 and make an appointment for a free 30-minute evaluation session, or you can also log on to their website, cnshealthcare.com. Remember, all their services are free and no referral or insurance is needed.